So this next component is really to try to demonstrate some of the things that are going on within our own state, because sometimes we don't see what's happening around us, and we wanted to give examples of how different groups are looking at ensuring that we build a culture of health within our communities.
If you've never heard of Minute Clinics, there are 37 of them in New Jersey, scattered throughout the state in select CVSs, and currently there's over 1,000 nationwide in 32 states. And in New Jersey, it is a clinic inside the CVS that is run by and you're seen by all nurse practitioners. 1,000 clinics, almost 3,000 nurse practitioners who operate independently, and we're providing primary care. We've gotten way past just doing streps. We do physicals. We can monitor your hypertension. We can do DOT physicals. We can treat most minor ailments. So what are the challenges of healthcare? We've all discussed them today. Shortage of primary care providers, lack of access points, rising healthcare costs, and an increased prevalence in chronic diseases. And at Minute Clinic, we're trying to address all of these. Nurse practitioners are providing primary care throughout the country. At Minute Clinic, they're also providing primary care. If they're on their way to school, they're on their way to work, at lunch, they can stop in, they got a sore throat, they got an ear infection, they need a sports physical, their DOT license requires a physical, they can stop in. They're worried about their blood pressure, they can stop in because we're conveniently located. We are also monitoring chronic diseases. So if you come in for a strep test, bronchitis, and we take your full history down, you say you're diabetic. When was your last hemoglobin A1C? Well, I haven't really had that in a year. We can either provide that for you or get on the phone with your PCP and set up an appointment for you. We now have 1,000 clinics, 2,800 providers, 7 days a week, all holidays. We're not just convenient, we are also affordable. And we believe in pricing transparency. How many times have you gone to a doctor? You have no idea what your insurance is being charged. You can check on our website so you know exactly what the costs will be at Minute Clinic. Think about it, we're bringing health care back into the community, we're providing better access. You're going to know what you're going to pay. You can do it during the day, you don't have to take time off from work, you can do it in the evenings, you can do it on the weekends. We also do patient satisfaction is also very important to us. We have a 92% patient satisfaction rate. We are committed to health care. We are committed to our providers. We have a very robust quality improvement department. We strive to be good stewards of antibiotic usage in the United States, and we all know that's a problem. We strive to help with all this. We do convenient, we have convenient testing. It's all point-of-care testing. We don't do phlebotomy in the clinics. We do some injection therapies. Quality improvement is very important. Wellness, putting our patients on the path to wellness is one of our sayings at Minute Clinic and CVS. We were definitely a disruptive innovation at the time. And 10 years later, I'm proud to say we're still committed to providing quality care, primary care, impacting the community health, and also committed to our nurse practitioners.
So PACE is a program of all-inclusive care for the elderly. Life St. Francis happens to be the name of my particular PACE organization, and it is the name that's been adopted by all the PACE organizations in New Jersey and Pennsylvania. We all will fit the word life in somewhere in our name. It is a long-term care option. We're part of the state's MLTSS, Managed Long-Term Services and Supports, that address the needs of frail elders who are nursing home eligible. We're unique in that we are comprehensive. We're 24/7 responsible for the population that we serve. We're community-based. Our goal is to keep people in the least restrictive setting possible. We work with an interdisciplinary team, and we're an integrated system of care. We're an organization that enrolls an individual at a point in time and hopefully cares for them through the end of their life in whatever setting of care they need to be. The goal is to promote dignity and independence for our frail elders. We aim to delay or avoid institutionalization, placement in a skilled nursing facility. And we care for our individual members, participants is what we call them, in whatever setting of care they require. We really strive to provide the right care in the right setting, at the right time, and with the right provider. And our goal is to care for our members through the end of their lives. You have to be at least 55 years of age or older. Okay, so a lot of you are excluded. You have to live in the service area. Each PACE organization makes a contract with the state and the federal government for a particular geographic area that will be their target population. You have to meet in New Jersey the level of care requirement to receive Medicaid services through the state. So you don't necessarily have to have Medicaid, but you have to meet that eligibility requirement, which is essentially you need assistance with 3 ADLs. The PACE team has to find that with whatever care they put together, they can keep you safely in the community at the time of your enrollment. So you meet nursing home eligibility, but the team thinks they can keep you safe at home. Here's where there's PACE in New Jersey right now. Our goal really, and so is the Department of Health's goal, is that every senior in every community in the state should have this as an option for their long-term care. What's unique about PACE? The first bullet is really important. Healthcare, as we know in this country, costs way too much money, and one of the reasons is everything comes out of separate buckets. Things don't talk to each other. PACE blends funding from Medicare and Medicaid, and that's very unique. If you're a senior, there's some things that will be covered under Medicare and some things under Medicaid. In PACE, we blend both of those funding sources, and we don't distinguish. We are capitated. We get a lump sum of money for each individual who enrolls, and then we're at risk to provide whatever services that individual needs, and we manage the bucket of funds. A PACE organization is both a payer and a provider. CMS has designated PACE under the Medicare program as a very particular type of provider. We're sort of like a Medicare Advantage program, but we have special requirements. And in New Jersey, we get a special license. We get a license, a PACE license, and then we provide whatever our participants need. The PACE Center is a unique feature of a PACE organization. It looks a lot like a day center, but it's where all the disciplines are based, and it's where our participants come anywhere from once a week to 6 times a week, and some actually don't come at all. We have what we call PACE at Home, but it is the hub. It's where all the disciplines get to interact with our participants and see them and talk to each other. And it's social, and it's nutrition, and it's rehab, and it's also where our primary care and nursing services are based. Our primary care provider becomes the gatekeeper for all the services the individual receives, including all the specialty services. So we really get to see the whole picture and manage all aspects of an individual's care. So these are the disciplines that are typically provided by employees of a PACE organization. The interdisciplinary team that I mentioned is key to a PACE organization. It's the case manager. Every member of that IDT does an assessment and participates in the care planning for each individual who's enrolled. And all that care is managed by that team. Core members of the team. The participant is at the center. This is truly a participant-centric healthcare model because it's what the participants' wishes are that determine the care plan that's developed. So there's a dietitian, there's primary care. We have both physician, geriatricians, and nurse practitioners. There's nurses that work in our center. There's nurses that work in home care. There's activity therapists. There's transportation. There's home care. There's certified home health aides, PT, OT, social work. So these are services PACE provides that aren't employed, but really critical to helping us keep people independent in the community. I mentioned that we're the pharmacy, so we contract with a pharmacy provider. We have contracts with assisted living, all the medical subspecialists, inpatient care. We provide orthotics, prosthetics, nursing home service, DME, dental services, and transportation is really, really a key factor. It provides access. Transportation in a PACE organization brings people to and from the center if they don't have another way to get there, to all their necessary appointments, and also for social outings. We also have contracts for home-delivered meals. We have ambulance services. Pest control is huge. Home repairs. These are the services at the center. Medical care, primary care. Some of our specialists do come into the center to provide services for our participants there. Our rehab team is based at the center. We provide therapeutic recreation, meals, personal care and laundry, and obviously transportation. We have 323 members. There's about 900 people in New Jersey right now being served through PACE organizations. Many people come to us with dozens of meds, literally, so managing meds is really important. With the support of the PACE team and access to the center, we're able to keep the majority of our people living safely at home. We really are committed to promoting the dignity, independence, autonomy, and quality of life for each of our participants. And we really do focus on participant satisfaction and quality of care, not just with Life St. Francis, but that's a hallmark of any PACE organization.